Thank you once again for joining us as we continue our discussion on the different types of fractures that can occur in the humerus and what to do when they occur. Now, today we're going to be looking at a very important topic. I'm very passionate about today's talk because we're looking at a topic that has led to morbidities and even mortalities that could have been avoided. I'll share with you a story about a 10-year-old boy who presented and he had his hand stuck in a machine, and somehow he was trying to pull it and he sustained an injury and a fracture affecting the distal part of the humerus, which is the area we refer to as the supracondylar region. Now there it is, okay? So once this fracture occurred, he was taken home and they started home care, and they applied by manipulation a very tight splint around that region of the arm. Now we're talking about somewhere around here, okay? And in the night of that same day, I remember that particular story. The young boy said he was shouting throughout the night for help, and nobody understood. They thought he was only screaming because he had pain at the fracture. They didn't know he was undergoing what we call a compartment syndrome that had just occurred in that particular hand. And by morning, they were surprised that the pain had gone down, but there was now swelling affecting the whole of the arm. Now the arm is the part from the elbow up to the hand. And they were happy. They thought they had achieved something, only for them to realize that the swelling was increasing remarkably, the pain was going down, but this time something else started happening. The boy was not feeling anything anymore in the hand, and gradually, until it became completely discolored, turned black. There was no blood flow to that hand, and the hand changed color and started oozing some watery discharge. And in their usual way, they thought they could help by busting the bullae that had occurred on the hand. That's some multiple areas of swelling containing some clear fluid in it. And from there, before they presented to the hospital, the hand was gone. And this was the right hand of a 10-year-old guy who could grow up to become anything. And this could have been avoided if they knew the right things to do. That hand ended up being amputated. I'm sure you've seen the picture. And this could have been avoided. Now, that's why I'm very passionate about today's topic. So I'm talking about fractures that occur in the supracondylar region, and they're very common in children. They usually occur following a fall and outstretched hand. So a child is running and then he stretches out his hands to break the fall, and then he hits it on the ground, and then there's a fracture. Now when that happens, that fracture can be a very simple fracture to manage. All right, just like the one we had last week. And then the child fell from a seat where I was climbing up on a chair, and then fell to the ground, landing with the elbow, sustained a supracondylar fracture. That's a fracture around this region as we're describing. And there was swelling, there was pain. The child will not let anybody touch the hand. Now that's usually how they will present. And then before you know it, the hand is swelling up. Okay? And the child is brought to the hospital. The first thing we do is to take care of the pain, resuscitate this child, make sure the child is stable, and then immobilize the arm, okay, by putting a simple collar and cuff, just tying something around the neck and putting something around the wrist. And so the arm is rested, and give the child painkillers, and then send the child for an x-ray. Okay, now this x-ray is done, and the x-ray will show the fracture configuration. Now once this fracture configuration is described, okay, the mix that gives the surgeon, the orthopedic surgeon, the opportunity to know what to do for this child. Now one of the ways we can treat this, okay, usually will involve some manipulation. Now this manipulation is not done blindly. We do it under image guidance, like the one I did last week. All right, we just put it under image guidance. Okay, we reduce the fracture, okay, and we take pictures with x-rays in the theater and confirm that the position is stable and well reduced, and then we pin it, all right, by putting pins, which you can see on the picture as displayed. So once you have that done, the next thing is to bring out the child from the theater, put it in a sling, and send the child home. After 2 weeks or thereabout, we'll do a repeat x-ray. Sometimes you see that it's stable and it's okay. You see us take out those pins and we commence physiotherapy, range of motion exercises, and that's done. As simple as this sounds, but many people don't do this. They opt for the more difficult option of applying tight splints and ending up with complications that lead to amputation that can be avoided. Please don't let this be your case. In Dr. Gerald's Healthline, we are concerned about your health. We're interested that you stay healthy, not just you, but you and your family. If you've heard this and there's a neighbor around you who has this problem, tell them to look for an orthopedic surgeon who will advise them appropriately. Don't go there and start doing home care, advice from neighbor and things like that. Those things have led to severe complications, morbidities, and even led to mortalities. And so I want to tell you, please make sure you stay safe and stay healthy by listening to the right information. That's why we're here with you online, trying to bring this to you live at your doorstep. I want to say thank you for listening in today. And I hope you heard this message. Please go ahead, share it with friends. If you're watching us online, you can share this video with your friends and your online so that people can hear and know what to do. That is why we're here. We're passionate that you stay healthy. Thank you, as we'll see you again in our next session. Good day.